Hello, hello, hello. Assalamu alaikum. Ji ayanu, pakhair agale, ni hao, chunashume, washmale, ohio gonzaimis, guten morgen, hola, bonjour, privyet, kaifahal, hale shuma chatore, ahlan wasalan, marhaba, buna, mucho, gracias, suaviab, bhalli kare. And thank you very much, ladies and gentlemen, for tuning into PTV World. You watching World this morning alongside the one and the only Shahzad Hasan Khan. Ladies and gentlemen, I think every single day when I wake up, this is a wonderful message which I wanted to give out to all of my audiences out there as well, and there's a reason behind it. And this is something which I've been thinking about lately as well. That we tend to kind of forget that we really need to thank our Allah Almighty, our Creator, every single day when we open our eyes. And there's a reason why I'm saying so, and that is that I really didn't have this habit, but eventually I've started to think about it that for all of those things we enjoy in our lives, after acquiring all of those things which we wanted to have in our life, which were our wants, they weren't our needs, they were our wants, that we kind of take them for granted. And thinking about all of this, I kind of came down to a point where I thought that, I should actually be thankful to my Creator for giving me this wonderful and amazing life where, alhamdulillah, I have so many followers out there. There are people, when God forbid you're down, you're sick, you're ill, they call you, they come up to you, and they want to know whether you're doing fine or not. And if you're not fine, they're not fine as well. So, I kind of started to think about all of my blessings as well, which I couldn't, obviously, because Allah has blessed us with so many things in this life that we really didn't ask for as well. And the only reason why I was so thankful, and one should always be thankful, is that when you actually look down, you see that there are so many people who really just want to be in your place. And this was this one reason where, it kind of clicked to me, and I was like that, whenever I'm down in my life, for whatever reason it is, the only thing I think is how many people would want to be at a place where I am right now. And the result was that there will be a lot of people, alhamdulillah. So why not be thankful to Allah Almighty? So every single day, whenever you're going to get up, please make sure that you're thankful to Allah Almighty, ladies and gentlemen. It is an important message. And in a way, you will start realizing that how many blessings Allah has bestowed upon you as well. So this is a wonderful message which I wanted to give away. And there's one more thing as well. And that is that, for this life which we have to ourselves, I think we have to utilize it in a way where, we have our own share, our families share as well, and then obviously we really need to look after you people as well, because this is the responsibility which we have to share amongst us, amongst our peers as well. So ladies and gentlemen, please, number one, make sure that you're looking after yourself very well as well, that you are thankful about this life, and that you're going to give back to the society as well. So over here, while I'm on this show as well, I mean, nobody knows for how long you're going to be in a position. Obviously, there's continuous progression and you need to move on in life. It is very important to share. But to share, there is one more important aspect which is going to back it up. And that is having a healthy life. Because ladies and gentlemen, God forbid for somebody who's not healthy or who's not looking after himself or herself to be healthier, from the previous day, they won't be able to give back to the society because they will be focusing all their energies on getting better. So why not to have a healthy lifestyle? And now when we speak about healthy lifestyle, ladies and gentlemen, a good heart is going to ensure a healthy lifestyle. And we really needed to talk about that as well. Because over here in our subcontinent, whenever we talk about Asia, cardiovascular diseases, ladies and gentlemen, are very common over here. And it's just because of the fact that the kind of lifestyle we have, it is very sedentary as well. We really do not feel like working out. We just want to sit back, relax, call our younger sister or brother and ask them to get me a glass of water because, hey, what happened? I dropped my crown. I was the king. So I think that we really need to change our mindsets over here. We really need to focus on the kind of lifestyle we need to have so that we can give back to the community, we can give back to the society, and that we are not just a liability to all of those people who live with us. Because if, God forbid, we're not going to be healthier, everybody will be looking after you, taking out time, which is nice, and one needs to do that. But for that lifestyle which you have been living through or which you have picked up for yourself, whether is it a good one or not is something which we wanted to talk about. And then there are so many myths about cardiovascular diseases and their treatments that we really needed to dedicate an entire segment to this as well. And who can actually tell us best than the expert himself, ladies and gentlemen. He's actually served in the United States of America as well. He's an interventional cardiologist. I love the way he dresses up as well, and I love the way he speaks as well, and he always makes sense as well. Ladies and gentlemen, we're very lucky that we've actually been joined by Professor Dr. Amjad Bhatt Sahab as well. Hello, sir. Assalamu alaikum. Good morning. How are you?
Walaikum assalam. Very good.
How's your heart?
Oh, fine.
Is it in love?
It is, was, is, will be, always.
Well, that's wonderful. So I think, starting on a lighter note, this is one thing I'm going to get started with. Do you think being in love can ensure a good heart health?
I think
it's a very philosophical question.
This is a metaphor,
yes.
basically. Yes, love, you have to define love.
Yeah.
Some people love exercise, for example. Some people love eating.
Yeah.
Some people love stuffing themselves. And some people are really in love, what you are referring to. Yes, being in love is good for heart.
That's wonderful. Thank you very much. And ladies and gentlemen, it's coming straight from the horse's mouth as well, the expert himself. But sir, to get started with our conversation, first of all, I would like to know what are the most common cardiovascular diseases we have in our region and why do we have them?
That's a very good question because it's a gambit of an entirety. It's a continuum of one process. And the most common, which a layperson understands, is a hypertension.
Okay.
But the most scary, not for doctors, for common person, is the heart attack.
Yeah.
Angina is synonymous with chest pain.
Yeah.
So if we take the cardiovascular disease, which is known to a layperson, besides the hypertension, is that my valves are blocked.
Yeah.
And I have clarified in one of the programs that it's not the valve. The valve is inside the heart.
Yeah.
It's the arteries,
right.
The vessels.
Exactly.
But layperson will call them, our valves are blocked. So coronary disease is the commonest besides hypertension because hypertension is part of this continuum of coronary disease.
Yeah.
So coronary disease is what we should talk today and will be a good topic actually for the public.
So let's get started, sir. So now speaking about hypertension, I think it's one of the most common problems. I think even a lot of people do not even know that they have hypertension as well. A lot of people I've come across, they wouldn't know that they have high blood pressure. They won't take any precautionary measures for that. They'll make sure that they're going to have eggs and all of that kind of diet, which is going to lead them towards more coronary diseases as well. So let's talk about hypertension in the first place and what hypertension can lead you to in terms of coronary diseases.
It's not only, the blame doesn't only stick to the lay public, the person, the patient, the doctors as well.
Okay.
Because hypertension is an entity itself. It's a subject itself. But unfortunate part, what I see all the time is how it's being taken by the doctors and how it's treated.
All right.
So that's the basic problem.
It is.
Not the patient itself. Because you'll have millions of people who have been walking around with high blood pressure. You go to a doctor's office, oh, blood pressure is normal. When people come to me and I ask them, what was the number?
Yeah.
They don't know.
Yeah, because they never got it checked.
Because the practice style we have here, there's no relationship between a doctor and a patient.
Exactly.
You don't sit down with the patient. You don't talk. Because it's so mechanistic. The practice style in Pakistan is so mechanistic that there's no time for the patient.
Exactly.
If you don't teach your patient, if you don't educate your patient and the family, you can never manage a patient. This is me speaking.
Yeah.
Patient doesn't know you're giving poison. I call all these medicines poison. They're popping pills. Next thing they have a stroke, they have a heart attack, they have a blindness. People are running around with the kidney failures from one entity, because it's a systemic disease.
Exactly.
And we don't understand, and we don't explain, and we don't educate our patients. Because when patients comes to me, what should I eat? I say, okay, you have a stent today, go home and eat pie. Sir, pie, nihari, what is? I say, yeah, but little bit.
Yeah.
That is, because I always believe supervised cheating is better than unsupervised cheating. If
Cheating,
you
yeah.
don't communicate, there's a statistics. If you don't tell the patient stop smoking at the time of heart attack, they will never stop.
Yeah.
Because the patient feels that was the time. So doctor didn't feel it was important to tell me.
Yeah.
Why should I stop now?
Exactly.
The point I'm making is hypertension may sound very simple, HTN if you abbreviate, very simple, but this is the most devastating problem.
All right.
The simplistic, but the most devastating. I remember an incident, I was in Alabama, my daughter called me, she was working in the emergency room. Pop, do you know this person? I said, yeah, he's my plumber. Oh, he came with a big stroke, and that's the first time ever
All right.
he came to emergency room.
All of a sudden with a stroke.
And I said, he's done deal. They flew him to Alabama, to Birmingham, but he was done. Now you understand the importance of this one. And when patients come to me, when I came to Pakistan, I printed out a form, which is an ambulatory blood pressure. The habit is, patient comes, they have a pill, they just gave it to the patient. That was a snap blood pressure. Never treat patient on a one snap blood pressure. Suppose you come to my clinic and the blood pressure is 140, 150. You come home, your actual blood pressure may be 110.
Yeah.
Now I'm popping the pill,
It's
which
gonna
my doctor
drop.
gave me. I'm falling everywhere. What's wrong with me? Or you may have a complication of
Exactly.
lower blood pressure.
Exactly.
So patients come to me, I don't treat, I give them the paper. And would you believe only one person brought that paper back? And that happens to be the person from South Africa.
All right.
He was visiting Pakistan. So this is habit, and I tell them this is more important than your medicine.
Yes, exactly.
Because I want to know what your actual blood pressure is, what your average blood pressure is.
And so thank you very much for sharing it as well, because yes, I've come across similar situations as well where people are just going to take your blood pressure for once only, and they won't let you rest for a while and just do it over and over again, so that they actually come down to a point where they know that, okay, this is the blood pressure, and God forbid, if they're going to give them the medicine, it's going to drop as well, which can be very dangerous once again. But so there's one more problem, and that is that in all of these years and with so much technology, we have not been able to figure out the reasons behind hypertension, because what we do is that we are actually treating a patient for the symptom he showed up with, but we're not treating the patient for the cause of that symptom. So how do we get to that?
When I come across the junior doctors who are coming in training, I tell them there are two prepositions for you, what and why. You have to know why
Yeah.
before you can treat what.
What?
If you understand those concepts, I think you'll be fine. When the patient comes to you with a hypertension, you got to know, is this primary or secondary? Because unless you treat the cause of that hypertension, if this is secondary,
Yeah.
you will not treat the hypertension. Also, you have to understand a given patient. Every patient is different.
Okay.
Don't treat every patient with a one stamp. A diabetic is different.
Exactly.
Recommendations are different. Heart failure patient is different. Recommendations are different. Cardiomyopathies are different. And so on and so forth. There are many. So you have to understand the patient itself. Manage the patient, don't treat the patient.
Exactly.
Let me put it in a summary. If you don't manage the patient, because the management should entail the entire patient
Exactly.
and the family and the circumstances and the situations and the lifestyle, and I can go on and on.
So are you telling that, once, God forbid, if somebody's going to show up with whatever symptoms of coronary diseases, you're going to be in conversation with their family as well?
Of course.
And what do you tell them?
I can tell you, in my United States practice, I have specific instructions to my nurses. If I ever have a complaint from the family, don't come back. I don't have to fire you.
All right.
Because family is the real sufferer.
Exactly.
You as a patient don't have a choice. I'll give you medicines, I'll give you needles, I'll give you even the scalpel on your body. The family have a choice, but they cannot. Because they cannot throw you out. They cannot ignore you.
Exactly.
So patient, he has no choice or she has no choice. But the family has a choice, but they are stuck.
Exactly.
And particularly in our society, in Pakistan,
Yep.
where we don't put patients in nursing homes and all that.
Yeah.
We are stuck with that no matter what. Life and death, we are stuck with you,
Yeah.
right? So you have to take care. And the system and the organization of our family is such. One family person is affected, entire family
Entire
is affected.
family is affected.
So if you don't educate the family, suppose you have a daughter or a son and you're the only two people. If she doesn't know, you're not able to get up, you're not able to perform, you're not able to do things. And if she doesn't know, who will suffer? Both of you.
Yeah, that's
You have to, because you're not getting your proper
Exactly.
management.
Yeah.
So family has to be taught. They have to be educated. How are you going to educate if you don't sit with the patient?
Exactly.
You have to have a rapport, the relationship with the patient. Believe me, I can't emphasize more, because this is how I practice. This is how I practiced in United States. I'll give you another example.
Sure.
In my practice, United States, every patient of mine knew Dr. Butt's 3 pet questions: weight loss, smoking, diet. And the 4th one, did you bring your medications? How many times you have been asked by your physician, where are your medications? Tell me.
I mean, I think a lot of times even the physician is never asked whether you're taking any other medication or not.
See?
Yeah.
So if you don't take, what I have seen in Pakistan, you have a file. When you are born, you have that prescription, that is in the file.
In the file, yeah.
When you're in the middle age, that prescription is in the file. I don't know what you're taking. So if you have the package with you, no, I know with my own eyes.
That this is
There's
what
no
happened.
confusion, because I call these poisons. But
Yeah.
I have to give you poison. They're good poisons for you. So this is because if you're not tuned to this kind of practice,
Exactly.
you will never think of.
And that's true, sir. And you know, talking about that, now let's just move on towards where hypertension can lead you. Can hypertension lead you towards, okay, stroke is one, and then can hypertension lead you to angina pain as well?
I just said it's a systemic disease.
All right.
So every system in your heart is going to be affected. Angina will be aggravated with part, because I think we talked about this, remember?
In the previous show we did
Deadly
together.
quartet.
Yes.
Remember that?
Yeah.
Hypertension is one of the deadly quartet. 4 major risk factors: diabetes, hypertension, obesity, dyslipidemias.
Yeah.
So you're prone to have, you're inviting angina, and then angina is leading to a heart attack. So don't just ignore hypertension. Don't ignore diabetes. Don't ignore your lifestyle and obesity.
Yeah.
Don't ignore your cholesterol. And don't ignore anything, actually.
Exactly. And that's important as well, ladies and gentlemen, that we're not supposed to ignore anything. And God forbid, if you feel that there's something wrong with you, I think that that's the time when you really need to go to the doctor rather than sitting on it. And we have a habit of sitting on things, ladies and gentlemen. Oh, कि ठीक हो जाएगा, कोई मसला नहीं, I'm going to give it 4 or 5 days. So please make sure that you don't do that, because you're putting your life at risk. And yes, that's the same thing which I said at the beginning of the show, that it's not just us who are the affectees, it's our family members as well. Now, sir,
But Shahzad, just let me, if I may,
Sure,
add
sir.
to this one. I always say, please get into the shoes of the patient.
Exactly.
Until you get into those shoes, you will never know what patient is going through. Financial, family, denial, no, it's not happening to me,
Exactly.
why it's happening to me, patient psyche, and what is available out there.
Yeah.
A patient comes to a doctor, oh, you have to deposit 3,000 rupees downstairs. Sorry, I don't have one. What he's going to do? Sit there, beg?
Exactly.
Hospital is not going to do. Doctor is not going to give it to anything to him. So he has to ignore these things, because he's going to see, I have 10 kids at home.
Exactly.
I don't have food. I don't have a dinner tonight.
Yeah.
Should I spend 3,000 rupees there? A
That's
fee?
true. That's true.
Yesterday, a patient came. I wrote down some tests, and I try to avoid. He comes back, so I don't have money. What that patient is going to do?
Exactly.
So we have to be cognizant of all these factors when you come across a patient. I have a patient right now, educated man. His daughter is at medical school. When I talked to him, when first day he was trying to be very smart man. Okay, I'm just going to go home, sir. I say, that will be against my advice. Nothing happened doesn't mean nothing will not happen.
Yeah.
That's another. You have to
That's right.
make the patient understand. You're a bad driver. You're driving 100 miles an hour every day. Oh, I never have an accident, but when it's going to happen, it's going to be a big one.
Yeah, exactly.
So same thing you have to convey to the patient. Yes, sir. I always, honestly, Shahzad, I tell, I'm a servant of yours. You're the boss. I can't touch you if you don't allow me. But being a servant, because I'm going to give you service.
Exactly.
The best I know, I'm not God. I openly tell patients, I'm not God. I'm going to do the best I can. Here's my card. My personal number is on my card.
Yes, it is.
I probably am the only in entire Pakistan.
Yeah.
Many people, you can't imagine the calls I receive from Afghanistan, from Australia, from Saudi Arabia, because my number is there.
Yeah.
And for them, it may be, for me, it's a useless question.
Yeah.
Not for the patient.
Exactly.
Because he's calling you because he thinks this is the man I can get my answer. To me, you got to be there
Exactly.
for that patient. So unless you develop this intuitiveness that this is how I'm going to approach a human being who happens to be my patient, because that patient is coming with the trust of their life.
And sir, obviously, once you have a physician who's going to hear you out, it actually relaxes you quite a lot as well. But now coming back to my question, because angina pain, ladies and gentlemen, it is very difficult for people to realize whether it's a chest muscle pain or it's angina pain as well. So we really need to figure that out as well with our viewers. God forbid, if you're at home and if you're experiencing that kind of pain, what would it look like? What would it feel like? And what are the treatments available for that?
Shahzad, it's doctor's responsibility to read in between the lines.
All right.
A patient is going to come to you, he's going to give you this story, this story, this story. It's to simulate that information is your responsibility.
Yeah.
But by definition, what we see in the literature, angina is a chest pain during exercise or activity relieved by rest. That's by definition angina. What is angina? It's a mini heart attack, basically. I'm talking not in technical terms for the layperson.
For
it's
your
a warning
understanding,
sign.
yeah.
It's a warning sign. It's a plaque rupture. How angina occurs? It's a pain. Angina typically, you can have a chest pain.
So which part? Over here, over here, over
Not
here?
necessarily.
All right.
I was coming to that. one.
Okay.
Because diabetics may not have the pain.
Yeah.
He may say, I just feel air is stuck here. My food doesn't go down. Pain is here. I feel a little ache. Now, when you see a patient, risk morphology, risk factors are the key for your decision making.
Yeah.
A diabetic comes to me, a female person who is obese also, who have a hypertension. No, he's 40+ year male. I don't have to be Einstein to know that this I would side towards angina rather than, oh, this is your gas, oh, this is your chest pain.
Yeah.
Because heart kills.
Exactly.
Gas is not going to kill you.
That's true, sir. That's true.
Chest pain is not going to kill you. So what is your utmost responsibility? The primary responsibility to save that life first. So geared toward, it's like when we take board exam, or if you see, I give you another example. A EKG person, a doctor brings you an EKG. This is ventricular arrhythmia, this is an artifact. As a doctor, does he have a coronary disease? Think of ventricular arrhythmia rather than just ignoring as an artifact.
Exactly.
Because ventricular arrhythmia is going to kill you. It's a killer. So save that. Same when you take board exams, that's how you approach as well. Because they want to see you, your mindset, that
Exactly.
you're erring towards safety first.
Exactly.
So same thing, if a 40+ man comes, let me give you statistics. A 40-year male with an atypical chest pain, probability of coronary disease is 46%.
Okay.
A 40 of just being 40 and male.
Yeah.
Now, if that's a typical symptom of angina, the probability of coronary disease is 79%.
That's high.
It's a killer.
Yes, it is.
So, as a doctor, that's your responsibility. Why it's important? Because you don't want to pile up $1 million for the workup,
Exactly.
but you don't want to ignore as well. And I've come across every day in my practice, because in Pakistan, what I have seen is the pay per service. You pay, you get service.
Exactly. That's true. But I think I would actually want people to have this, know this, in fact, for a reason, because people over here cannot judge by themselves as well. You know, there have been very different theories about it. We have had another cardiologist on the show as well, and he said that, you know, if it's heart pain, it's going to be somewhere here in the center. You know, it's not going to be on the left, and it's not going to be on the right. I mean, for somebody, God forbid, if they have angina pain, how do they realize that they really need to go to the doctor? Because we really need to tell them about the right areas.
I don't want to comment on that, what you just said, but not necessarily. If the heart is here, the pain will be here.
Yeah, okay. I think that was important.
There was a doctor. Let me prove this point. He went to his friend that I have a toothache.
Yeah.
He went to dentist, and that's a real incident. He says, Doc, everything's fine. Let's have an EKG. So he was smutty, and he was having a heart attack. The referred
And he
pain,
knew.
Yes, sir. The true referred, if you really want to talk about the literature, yes, it's a precardium right here. And the way they referred, the trapezius muscle, not the arm.
All right.
That's the radiation, if you take it in true sense.
Okay.
Some people say, just tingling. No pain.
Yeah.
What I said, it's a doctor who has to read in between the lines in concert with the risk factor profile of the patient and what is patient telling you.
Exactly. And
So
thank you
who's the best doctor? Who has two good ears.
Exactly, and thank you very much for sharing it as well, because I believe that every doctor needs to do that, that God forbid, even because I've had this in my family as well, and that, you know, that my papa was actually sent back and the doctor said that it's just gas, and he actually passed away an hour later, and he was having a heart attack. So, you know, I think it's best.
I just said it's a killer.
Yes, yes, and thank you very much for saying that we really need to secure it first and then move on towards the treatment. But so very quickly, one last question, and that is that, you know, we were discussing it before the show as well, that for all of these kind of angina pains, we have this treatment known as Ecpt. What is that, and when should we get it?
First of all, it stands for external, enhanced, counterpulsation therapy.
All right.
EECPT. It's the same concept as we have intra-aortic balloon pump, but that's inside.
Yeah.
ECPT is a bed. I was the only clinic in the United States in early 2000 who was offering this treatment. It's a treatment. But the problem in Pakistan, what I see, two people actually, companies came to me that we want to start here. And I said, yeah, we can. But this is, the way the advert I saw on TV, it just raised my eyebrows.
What happened?
Because this will be a killer.
Okay.
This company, somewhere in Karachi, they're advertising. And the selling pitch was this patient laying on that table. I have a picture actually, if you can want to show how it works.
Yeah, sure.
I brought it. It is small, but
I think we would want people to see it so that they
printed
can
it out
decide for themselves
what
as well.
it is. Can you focus this one?
I hope we can. You know, we're going to give it a try. It's
Or
a
you
black
can
and white
just,
picture as well.
Focus
Yes.
there and see if this is a bed. There are straps.
Yeah, we're going to focus. Yes, there it is.
The patient lays down,
Yeah.
and then you strap all these straps. You wrap around legs, hip, to the abdomen.
Yeah.
I used to do with the arms as well.
All right.
So it have an intermittent compression.
All right.
So it pumps the blood back towards your heart.
Yeah.
That's the concept.
All right.
Now, if you give the impression to the patient, oh, this is so cheap, which was the selling pitch, and that scared me.
All right.
And that's when I contacted you people
Yeah.
to talk on this one. This is scary.
Okay.
This is just an additional management part. For who? Chronic stable angina.
All right.
Not your papa who was having a heart attack.
Exactly.
Not
So it's not for everyone.
no, not at all. And this is not an absolute treatment.
And is it a treatment or is it a testing system?
It's a treatment.
Okay.
But who were the patient who were not the candidate anymore, not the first time, anymore for medications? You have exhausted medications. You have exhausted stenting, bypass, they continue to have. Or the patients who are not candidate
All right.
for any of this one.
I truly get that.
So that is where this additional treatment can come into play.
And is it a good treatment?
It is okay treatment.
It is an okay treatment.
Why I'm not using the word good? Because that's going to give
People a different
very
vibe.
wrong impression, a very
Thank you very much, sir. You're definitely a lifesaver as well, and thank you very much for sharing
My
all of your
pleasure.
research and all of your work with us as well, and letting people know that they really need to get themselves tested. And God forbid, if there's hypertension, if there are any other symptoms, you really need to go to the doctor. And you know, sometimes, ladies and gentlemen, it's just everything is very silent. You might not even get to know. So it's better that we get ourselves tested after every 6 months or a year's time as well, which is going to ensure, inshallah, that that we're living a healthy lifestyle and that everything is working properly. Thank you very much,
But
Dr. Saab.
Shahzad, today's message should be for those people who are giving this wrong hope to the patients. Don't do this.
Exactly. And
Show them the video. I used to show the video before. There are 35 treatments, an hour
Exactly.
treatment daily. Daily, 35 treatment, 1 hour daily. And for some people, they cannot. There are some people who are not candidate.
Yeah, exactly. And I think the message today should be that, please make sure that you're actually going to go for a second opinion as well. Go to another doctor, ask them whether whatever treatment you're going to pick up on, is it going to be a good one or not? Is it going to help you or not? Or is it going to help you eradicate what actually caused the entire symptom as well? But thank you very much, sir, for being with us. It was wonderful to have you. And it is always wonderful to be in company of all of those people, ladies and gentlemen, who are really willing to be out there for all of those people who are out there in problems and in troubles as well. So, ladies and gentlemen, with that, we're actually going to go ahead towards a short break. But when you guys will come back, it is very important to have a good communication skill. And obviously, when you have a doctor who's all ears for you, you really need to communicate. How do we do that is something which we will be talking about in the next segment as well. Please don't go anywhere. We will be right back. Good morning. Thank you very much, sir. All right, ladies and gentlemen, thank you very much for staying tuned, and for everybody who just tuned into PTV World, you watching World this morning alongside Shahzad Hassan Khan. Ladies and gentlemen, earlier we were actually in conversation with an interventional cardiologist, and he kind of I think he kind of convinced everybody that we really need to be careful about our heart health, because heart health, ladies and gentlemen, is going to ensure a good life and a good lifestyle as well. And for all of those people who will be around you, will be happier than ever as well. But how do we do that? I think it is very important, and it's not just important in the case of a doctor. I think it's as important in the case of a lawyer. It's as important in the case, if God forbid, or fortunately you're in love, you need to communicate. And a lot of people do not know how to get those things across, or how to get all of those thoughts which you were getting all through the day, all through the years, to the next person, so that they can understand and they can find a solution for you. So having good communication skills, even at office space, even while you're at work, even if you're out with colleagues, it is very important to know how you're going to communicate. Not just because you wanted to share something, but ladies and gentlemen, half of the time whenever we're in office, majority of the people unfortunately do not know what the right jargon is to use, or probably which way to communicate with your boss. God forbid you will use words which your boss might be offended of, and you really do not want to offend someone. And all of these things will come under one umbrella, and that umbrella is communication skills, ladies and gentlemen. We will move on to personality development, but since we are not left with a lot of time, so we're just going to focus on communication skills, how to get your hands onto them, and how to make sure that you're going to get your message across in the right manner, and that it should actually tap the right point which you wanted to tap on as well. You know, not here to the left or not here to the right. Bullseye, that's what you want every time you talk to somebody. And to talk about this, we're very lucky that we've actually been joined by somebody who happens to be a corona survivor in the first place, and that he's been my professor in my university as well. He's been a great guy so far, alhamdulillah. He's always been very helpful as well. And today we wanted him to speak about communication skills, because he knows how to get the bullseye. Ladies and gentlemen, he is Mr. Asif Rasool Saab. Hello, sir. Assalamu alaikum. Welcome back.
Assalam. Thank you very much.
Thank you very much for joining us. Wonderful to have you. You look all healthy and wealthy as well. Alhamdulillah.
Alhamdulillah. Now we've properly recovered from it.
Shukr, alhamdulillah. And alongside Mr. Asif Rasool, ladies and gentlemen, we have been actually joined by somebody who actually happens to be the lecturer for communication skills as well. She is Ms. Saida Sarish Batul. Hello. Assalamu alaikum. Good morning.
Walaikum salam. Good morning to you, and thank you.
Thank you very much for joining us. Wonderful to have you. So, sir, I'm going to get started with you. What are the most common mistakes people make in making sure that somebody is going to get their point, but they don't? In fact, they offend other people wherever they are.
Well, I'll just start off with this Stephen Beebe's quote, which he quoted in his one of very famous books of interpersonal communication skills. He says, communication is to a relationship what breathing is to maintaining life.
All right.
Now, from this we can exactly understand the way we have got Shazad, all other social skills.
Yep.
And we just develop in those areas. Similarly, John Maxwell, he says this effective communication is basically intentional. Okay. The way we have got principles, formulas in all other aspects of life, we've got similar kind of principle in our life. For example, you must be familiar with one named Larry King.
Yeah.
He just came up with a wonderful book. The other night I was just going through this book. So just
you had a lot of time to yourself. I'm sorry to say this.
Exactly.
Yeah.
So got like, if we just talk about the main aspects,
yes,
there are like four. Number one is warmth. When you communicate with the people, for example, when you start up with your show early in the morning, so you just show a lot of warmth early in the morning. Like people are just going to watch early in the morning. So just like one aspect. Second is genuineness.
Yeah.
I mean, when you just communicate, so you have got to properly get connected with the people.
Yeah.
If you are unable to get connected, so this is like another aspect. Third one is empathy.
Yeah.
Now, this is like one of the aspects where most of the people, they suffer very badly when it comes to effective communication. And this like they violate a lot. Yeah. Until and unless you're not going to put into yourself, into people's shoes, you cannot understand the world from their perspective.
Exactly.
It gets very difficult for you to just to communicate. Now, you can apply it in both aspects, personal life or professional life. And last but not the least, unconditional positive regard, where I said this is just a refinement of your personality.
Yep.
I mean, it takes a lot of, courage and all that just to develop this perspective.
Yeah.
And these are basically four aspects. If we just do it opposite, so those are basically things which are really going to offend people.
That's true. So let's revise. You know, so for you said empathy, you said positive regard, warmth, and what's
Empathy,
the last one?
Genuineness.
Genuineness. All of these things are, ladies and gentlemen, I think should be the traits of any other person who's out there. You know, we shouldn't be really pushing ourselves to do it, but there are conditions when we actually have to push ourselves. Which is why, Sarish, you know, I know that this is my first question to you, but it's a little tough one, and I need to know what will be your answer, since you are teaching students communication skills as well. Now you come across, Saraswati Rasool Sahib even mentioned about it, that, there's your personal life and then there's your professional life as well. Professional life, you have to do things which you don't even feel like. In your personal life, you come across situations where there's so many guests all of a sudden at your place, you really don't want to talk to anybody because you talk all day. You get paid for talking, just see me as an example that I have to talk to you guys right now, right? It's my job. But other than that, I have that positive gratitude and everything. But once I'm going to go back home, I want to rest myself. I want to rest my mouth for a while. I want to rest my brain.
Sure.
So in a situation where I don't feel like communicating, how do you think my body language should be that the other person should understand that he might not be in the right mood, but he does not get a vibe that he's not very positive, he's not very warm? What should we do? How do we communicate just with our body?
Okay, so if we talk about the communication with body gestures or body language, so when we say communication, it's basically part, or we can say the way to communicate is spoken or verbal communication, and like we are doing at right now. So non-verbal communication or with body language. So first of all, the important thing is that we should have to look at this. We are just relax.
Yeah.
First of all, we have to just relax. We have to be confident that what we are saying, that what we are doing is really fine. That first of all, if I came to your home and you are just busy, or we can say that you're bored. Okay?
Yeah.
So what you have to do is you have to just keep calm, relax, and you have to smile.
Yeah.
The smiling is, I think, the key of everything, a key to
Exactly.
heart at the same time.
Exactly.
Yes.
But somebody, I think eventually in Pakistan over here, we end up doing like this. Maaf kar de, bhai,
Yes, true.
thak gaya hoon main.
True.
But yeah, I think it's fine as well. Even if you say that with a smile, I think people will understand as well. Which is why I'm going to ask you now that for all of those 4 things we have spoken about, how do you think people can inculcate that within their own personalities?
Exactly, this is a very good question. Why John Maxwell said that effective communication is basically intentional. It means that you have got to just work on that. So without like knowing it, for example, before going through these principles, I mean, whenever I just tried to communicate, so whatever the ways I knew, I just tried. But now, after knowing it, whenever I go to meet someone, so I mean, it's same like the way Shahzad opens up the show early in the morning. Similarly, when I interact with someone, so I'm just going to feel them very good,
Yeah.
and they should be very happy after just meeting it to me. And second is like looking at their perspective. This is how I'm going to properly get connected with the people.
Exactly.
And especially I've got to avoid this blame game, because this blaming, it kills your relationship, whether it's personal life or professional life.
It does.
So we have got to just avoid, and you have got to absorb a lot. You have got to have very strong shock absorber so that you are able to absorb a lot, and then you have got to communicate.
Exactly, and that's true. But here's a difficult situation, Cyrus. This one's for you as well. Once again, I'm sorry that I have to ask this from you, but a lot of times I've realized that there are a lot of people who are carrying this entire baggage onto their shoulders, and the first person they're going to meet in the day, they're going to throw it all onto them. How important it is for anybody who says that they are a communication expert, that there really needs to be a listening or hearing expert as well. How important it is for that person?
Okay, for you want to know for that person who is teaching?
No, I'm not saying that. So what I'm trying to say over here is that, since we're emphasizing on how important communication skills are for you in life, imagine that somebody has already inculcated all of these 4 or 5 things.
True.
How important it is for them to be a good listener as well.
Okay, so if we talk about the hearing loss, so communication basically, speech, language, and the main cause we can say of communication disorders can be hearing loss. Hearing loss, if we talk about specifically, so hearing loss basically that you are unable to hear. When you are unable to hear physically or biologically, we can say, when you are unable to hear, so hearing loss basically.
No, that's not what I'm talking about. I'm sorry, I think you got it wrong as well.
Okay.
What I'm trying to say over here is for how important it is for any individual to be a good listener.
Okay.
Because when we are emphasizing on communication skills, that you want to communicate, that's good. But a person who's an expert at communication skills need to know that I have to listen to other people rather than just communicating.
Okay, so first of all, the most important thing is that we should have to be quiet. When, for example, when you are talking, so I should be quiet, so I can learn, so I can listen you Okay, when we listen, then we can get the point.
Exactly.
Okay, for example, the recent example I can quote that you have saying something else and I have answered something else. This
Yeah.
can be a misunderstanding due to might be it's possible that I am not listening to you very well.
Exactly.
Or might be possible
But
that
imagine, do you think that I did it right because I'm still smiling? so I'm going to move on to Asif Saab over here as well. So Asif Saab, have you got my point?
Exactly. Without this effective communication, you cannot learn, you cannot grow, and especially when you are in a kind of interaction, whether it's one-on-one or with a group or with a larger audience.
Yeah.
So until unless you're not going to get these points very clear in your head,
Yeah.
you won't be able to communicate.
All right.
And Larry King, the guru of
Yeah.
this morning shows, he says that whenever I wake up early in the morning, so I always tell one thing to myself, that if I'm going to speak a lot, I won't learn anything.
Exactly.
But if I'm going to listen a lot,
Yeah.
I learn something. So
Exactly.
that's why this is very important for us just to understand people from their end.
And that's wonderful. And since you even touched upon public speaking as well in larger gatherings, how important it is to have eye contact?
Yes, especially in, if you've got to properly see, because this is a very good question. You have got like this, your eyes, they're really going to regulate a lot.
Yeah.
I mean, you can understand audience, where do you stand? For example, when I just go for these corporate training, or even at student level.
Yep.
So when you just go to the class, you suddenly see that, some student, they are saying that, who are you? Why did you come here? And then with the passage of time, you get to know that, some people have started smiling, some
Yeah.
people. So this really plays a very important role, and your eyes are going to regulate your communication.
Exactly.
That now perhaps they are over, they are bored to death and they do not want to listen. So
Yeah.
usually you just go for a lot many strategies, and your eye contact is going to
And you
help a
need
lot.
those strategies as well. And
Exactly.
I think I'm going to share. I think I'm going to share one of my. In fact, I think it's a trade secret, ladies and gentlemen. I shouldn't be giving it away, but probably we'll do it another day. But one last thing, on a very lighter note, before we wrap up this show, and it's from both the genders as well. May it be a male, may it be a female. Eventually, no matter how much of an expert you are of communication skills and how good you are at communicating, no matter what happens. But if you're in a marriage, I think it comes down to point zero every time you're going to start talking to your partner. I mean, it's not really important that it's going to happen, but I think there are 50% chances that it does happen as well. So no matter how bigger of an expert you are, may it be your wife or may it be you yourself, the husband in a relationship, you just can't get the point across at times. Why do we fail in a position of such sort?
This is the peak of
I'm sorry that I
your
asked this, yes.
genuineness with someone, and then nobody is going to listen. Sometimes these people are making
Because they
fun.
know you so well. They're like, oh, you know what, you're just talking. We know you, that you do not really mean any word you have said.
Exactly. I mean, especially when I just get to the different shows. So when I go back, so usually my better half is saying that, you know what you were saying, that's not the part of your personality. And then you just laugh a lot, that, for God's sake.
Yeah, that's
I did. But I really wonder, like people like John Maxwell, Larry King, and some other people, whenever they are in the big gathering, I mean, they are always appreciating. I don't understand. I was expecting this very nice question from you.
Yeah.
But I do not understand that whether it's just to make people happy that I've got a very nice relationship inside my house. They just tell everyone that, well, I was having very nice and all that.
Well, thank you very much for joining us. It was wonderful to have you on my show, sir, and I think we had a wonderful conversation. I mean, because if we cannot talk about whatever we feel like, there's no point in communicating, ladies and gentlemen. Always make sure that you talk your head, and it is important to make sense as well and know where you are, know your values, know your culture, and speak relatively, ladies and gentlemen. But thank you very much for joining us. For everybody who's out there, ladies and gentlemen, if there's anything you want to share with us, please make sure that you write to us on our Facebook page, which is with the name World This Morning. On Twitter, it's World This Morning without a G. On Daily Motion in YouTube, it's World This Morning. The fabulous repeat is going to be at 5 past midnight. Till the next time, ladies and gentlemen, look after yourselves. 1, 2, 3. Good morning. Bye-bye.